Hi, I'm Dr. Caitlin Keller with Unconstipated Kids, and we are here to help you help your child improve their bowel and bladder health so that they can keep their underwear clean and dry. Stay tuned and watch more.
So, why would you complete bowel massage on your child in the first place? A bowel massage does a couple of things, and it's really effective at doing those couple of things. And this tends to help your child either move the poop through their intestines. That's the motility. So, when we say motility, that's how stool moves through our intestines. And our intestines should be doing that on a regular rhythmical rate. So, about every 90 minutes. Every 90 minutes, our intestines are contracting and relaxing to help push poop through. And so the process of doing bowel massage can stimulate the intestines to do that. So the intestines are made up of muscle. And if we do massage, we're kind of stimulating that muscle to contract. So massage can help the intestinal contractions begin. And the belly massage can also help release tight abdominal tissue. So sometimes when kids have a history of constipation, gut disruption, slowed movement through the belly, they can get tight tissue. So the connective tissue, the fascia, everything that we have surrounding our muscles and organs in our abdomen, those tissues can get tight. So bowel massage can help release those tight tissues. And then the third thing that it does is it helps to physically move poop through. So as you're massaging, you're creating areas of pressure, high pressure, and so the poop in the intestinal tract is going to move to areas of lower pressure just because that's how physics works. So if we create areas of high pressure, that helps to push the poop through if it's struggling to move through at a regular rate.
If your child is struggling with keeping their stool soft or having regular bowel movements or abdominal pain, then bowel massage might be something great that you can implement because it's free and you can do it at home and it's effective. And so how this works is it stimulates your bowels. It stimulates that muscle within the intestinal wall to contract. And we want that contraction happening on a regular basis, upwards of every 90 minutes. And what we find in kids that have a history of gut disruption and bowel disruption and constipation is that that's not happening on a regular basis. So the abdominal massage is stimulating that process called peristalsis, the contraction and relaxation, the rhythmic contraction of the intestinal movement to get poop through. And so massage does that. It's a really easy way to turn that on. So yes, medication can be a route that does stimulate intestinal contraction. There's absolutely medications that do that stimulate that contraction. But then you go down this route of medication. So if that's something that you're looking to avoid, bowel massage can do that same process. The thing that you need to keep in mind is that you need to do it on a regular basis because we do want the bowels to be stimulating we do want the bowels to be contracting rhythmically on a regular basis. So bowel massage stimulates that contraction. Bowel massage also physically pushes poop through with the pressure that you're using through massage. And then it also helps to release any kind of tension throughout the abdominal cavity, the connective tissue that we have in our abdomen, because if that tissue remains tight and restricted, then that's going to restrict the bowel's ability to contract and relax and move poop through. And if that's happening, then that tense tissue might prevent the stool from moving through appropriately.
So before you begin abdominal massage, you want to set yourself up for success. So the first thing to think about is the environment. Make sure that the environment is calm and relaxed. So you can use things like low lighting or calm music to help your child get into the frame of mind of, okay, I'm going to turn off all of my muscles throughout my body and relax for this bowel massage. You want to make sure that you're supporting your child's knees, so something underneath their knees, and you'll see in the next video about how to do that. That really helps their abdominal cavity and musculature to relax. And then you want to communicate to your child what their responsibilities through this activity is. And what they're responsible for is number one, making sure that their body stays relaxed, that all of their muscles throughout their body stay turned off. And then number two, their job is to communicate to you when they feel or hear bubbles or gurgles in their belly. And so what I mean by bubbles and gurgles, that is their intestinal tract turning on. That is their intestinal tract starting to complete that peristalsis process, and or it's the process of the poop starting to move through. And what this does is it gives your child an opportunity to connect through the neurological system their sensory perception of their abdomen. So can they perceive sensations that are occurring in their abdomen? And if they can't, or it's really challenging, this is a great opportunity for them to practice it, which then later carries over to their ability to perceive sensations related to bladder urgency, so urgency to go to the bathroom for pee or for poop through their rectal perception. So let's talk about what you want to do during bowel massage with your child. So we talked about setting up the environment. This is me getting this child's body in a great position to stay relaxed with my leg underneath their knees to support them. You want to ask if you can see their belly. You want to warm up your hands to make sure that you're not going to touch them and surprise them with cold hands. So this is what I'm doing here. And then throughout the entire massage, the entire time, you want to keep 100% of both of your hands on their abdomen the entire time. This is going to prevent them from increasing in that ticklish sensation if your child is prone to that. They also know where your hands are, so they're not surprised or jumping in response to that, which can activate those muscles. And then as you initiate, you want to think about, if you're looking at your child's abdomen, that you want to move in a clockwise direction. There's lots of different techniques for bowel massage that are out there, and some of them talk about variabilities of this, but this is a great place to start. So you want to go in a clockwise direction, thinking about their large intestines, which if you're looking at their belly, the large intestines looks like a big question mark. So it starts at the bottom left-hand corner of the abdomen, and then it goes up towards the ribs, across, over, and down. So I'm moving through that question mark. And so as you move through, depending on your body mechanics, you're going to change how you apply pressure. So here I'm using both of my thumbs just because for my body mechanics in how the position that I'm in, this works best for me in my hands. And then as I move, I change the position of my hands and how I'm applying the pressure. So you can see I changed the positioning of my hands. Now I'm using my center 3 fingers. And those are the 2 ways that I'm typically going to apply pressure. So either through my middle 3 fingers or my thumb, or a combination of both. Here I'm starting to apply pressure up underneath the rib cage, and this is important because it allows diaphragm movement and addresses the connective tissue that is near the diaphragm. And there's a whole list of reasons why this is really important, but just know that you're addressing tension that might be affecting the diaphragm muscle here. So going up underneath the ribs. And my right thumb right now is almost disappearing underneath his ribs. He's limited in just a little bit of mobility here. So my thumb should really be disappearing up underneath the rib cage. And so that's what you would expect. As I move down here, I'm doing more large intestines stimulation. I'm now moving into a little bit closer to the belly button. And so if you're doing this at home, you're just going to continue in that clockwise direction. And sometimes you can vary. If you can be closer to the belly button, and then the next time you go around, you might be further away from the belly button. And that is ideal because we don't know where your child's large intestine is. Some important details to think about as you move through massage for your child. So you're going to continue in that clockwise direction for upwards of 5 to 10 minutes to really engage the large intestines to start that peristalsis movement that we talked about before. So then as you move through it, some things to think about. Your hands, where you're applying pressure, you want to stay in that that area to apply pressure for anywhere from 3 to 10 seconds per location. And that's giving your child enough time to really relax as you've moved to that new location. And then it's also allowing that pressure to release any tension that might be affecting the tissue where you're applying the pressure. So think about 3 to 10 seconds per location. And then as you move through, you want to think about the depth of your pressure. And so for a child with no gut disruption and has no tension throughout their abdomen, we would expect you to be able to easily apply pressure to the point of about 50% of the depth of your child's abdominal depth. And so I'm going to show you a video here in a second about what that looks like from the side view. So you want to think about the depth that you're going as you complete the abdominal massage. You also want to make sure that you're doing the abdominal massage for long enough. So that means that you're completing the massage ideally until you start hearing an increase in bowel sounds. And if that's not happening for your child, then you want to think about maybe a minimum of 5 minutes. And then you're just going to continue to repeat the massage to try to stimulate their peristaltic movement of their intestinal tract on a regular basis. And that can be once a day, that can be more or less, kind of depending on what your child needs. But the idea is that the massage stimulates that peristalsis movement, and so then within that 5 minutes, you're hearing those bowel sounds increase or initiate during the massage. So we talked about making sure that you're going to an appropriate depth when you're completing the bowel massage. So this is a side view to show you what that looks like as we're completing the massage. So I am about maybe 40%, not quite 50% right now. That's about 50% right there. 50% of the abdominal depth of your child's abdominal cavity. And it can feel a little intimidating if you've never done this before. Are you going to harm your child? They are going to stop you either verbally or through facial expressions when it's uncomfortable. And so I would not press through discomfort, but you do want to go to your child's comfort level while also getting some stretch of the tissue. And so if that's maybe 10 or 20% or even less of the depth of their abdominal cavity, that's okay if that's where you're starting. Just know that the goal is 50%. In a healthy abdomen, the goal is 50%. Skin mobility is the forgotten component of bowel massage. So we need the superficial, so the outermost layer of our abdominal cavity to be able to move. And so we should be able to pull the skin away from the muscle layer underneath the skin. We should be able to move and roll it in all different directions because that indicates fascial connective tissue mobility deeper underneath it. So if there is restriction of how our skin can move on the outermost layer, that is an indication that the connective tissue underneath is also tight. So the reverse is true too. We can treat or work on the skin mobility, and that can help the deeper connective tissue throughout our abdomen to relax and to release and to have more mobility, which is what we need for healthy gut mobility, motility, the ability of our large intestine to move stool through that peristalsis. So let's look at how we do that skin mobility. You need friction in your hands, so avoid anything like sweat or lotions or anything like that. No body oils as you're doing this. You need friction because you need to pull the skin away from the muscle layer underneath. There needs to be an ability for you to pull it up and away from the muscle. So as you do this, and I'm going to show you how you do it, you're going to roll and pull and lift in all different directions. So if you're familiar with scar massage, it's similar to that. And as you move through this, same thing applies from what we talked about earlier with bowel massage. You want to move slowly, sustain tension, and as you work through discomfort that your child might be experiencing, you might increase in magnitude as tissues stretch out. And that might happen within the session that you're doing bowel massage or skin mobility, but it might happen over a period of weeks or months. So stretching out connective tissue can be a long process. And working through this skin mobility regularly, the frequency of it is what's going to increase that mobility long term. So think about frequency of completing bowel massage over the length of time you actually complete per session. So here I'm going to show you a little bit about how to do some skin mobility. So right now my left hand, the center three fingers, are pulling up and away from the pelvic region. So I'm taking the skin and pulling up towards his belly button and kind of moving in a rainbow movement. And so this is addressing all of the connective tissue near the bladder and the bowel at the very bottom, near our pelvic region. And so this is a great place to start. So now I'm working on skin mobility near the diaphragm. So pulling away from the rib cage, that's where the diaphragm muscle is, underneath that rib cage. And this is into traditional skin rolling. So I am taking my thumb and forefinger and pulling the skin up and away. So right now I'm not actually rolling anything, I'm just pulling it away from the underlying muscle underneath it. So this is where you can start. So you can just pull it up and away. And then I'm slowly starting to add some roll. I'll show you a little bit more about how you can start then pulling up and away, but then rolling it. Let's see. There are lots of different ways that you can apply friction and move the skin on top of the underlying muscle. So play around with what feels good with your body. And then here I am moving into more traditional skin rolling. So I'm pulling up away from the muscle and then I'm using my fingers to roll it in any direction. So you can go diagonally across the belly, you can go vertically up and down, you can go horizontally. So here's a side view of what that looks like so you can get an idea of how much magnitude I'm pulling up and away from the underlying muscle. Hip flexor muscle release. So our hip flexor muscles are very near and integrated close with the pelvic floor muscles. So oftentimes if there's bowel and bladder dysfunction and pelvic floor dysfunction, there's very also likely some involvement of the hip flexor muscle. So applying some release or stretch to the hip flexor muscle group will be beneficial. You can do that, like I said, through stretching, but you can also do it through some manual work. And so this is an idea of how you can apply that for your child. And so I'm going to show you how to do it. But as with any other stretch, you're going to try to aim for 1 to 3 minutes per hip. And depending on your child, that might look different for you. So we are going to do a hip flexor muscle release. So his legs are still up over mine to give him some slight hip flexion. I'm using my left hand right now to palpate or press into the hip flexor. So that's deep in that hip. And I'm pressing in, finding that tenderness, or I'm feeling some muscle bulk. He can tell you if your child can tell you if they're feeling tenderness. So pressure down into the hip joint. And then you can do, I'm going a little fast here, side to side movement of the knee, and that helps the hip flexor to move just a little bit. So you're sustaining that pressure through the hip. So right now with my left thumb, as you do that back and forth movement with the knee.
Unconstipated Kids has a mission to serve and help families that have children that are struggling through toileting dysfunction or dirty or wet underwear, bedwetting, any kind of dysfunction related to bowel and bladder health. And so I really hope that this video is part of your journey to helping your child have better health and a quality of life where you don't have to think about their toileting anymore. And so if this was helpful to you, drop a like or a comment in the comments below. Don't forget to subscribe to our YouTube channel, sign up for our email newsletter, and then also if you're still needing some support, check out our website for our other service offerings to see if there's anything that resonates with you.